each day that passes, health officials are learning more and more about the coronavirus.
And this morning, there's new research on how your blood type may impact your risk.
We're going to talk about that with Dr. John Torres in just a moment. But first, the very latest findings. As coronavirus cases surge across the country, new research now has many asking, how does your blood type impact your risk? Of the four main blood groups, A, B, AB, and O, people with type O blood have a lower risk of coronavirus infection, while those with type A have a greater risk. That's according to research published in the New England Journal of Medicine. In the study of more than 1,600 patients testing positive for COVID-19, those with type A blood were 45% more likely to develop a severe case requiring oxygen or a ventilator, while those with type O blood were 35% less likely to have such an acute case. The genetic testing company 23andMe also releasing data that shows O blood type appears to protect people from the virus more than the other types. But doctors point out, regardless of your blood type, no one is guaranteed protection, and factors like age and underlying health conditions are more important.
Gonna double down.
And now we want to take a closer look at this research with our medical correspondent, Dr. John Torres. Dr. Torres, always good to see you. And we should probably start with the caveat here that we're talking about correlation, not causation. But knowing that, top lines from this study, Dr. John, what are you taking away?
And you're right, Craig. This is showing an association that there's less risk if you have certain blood types, particularly type O, and maybe more risk if you have type A. The B and the AB, we're not really sure because there aren't that many people with it. But the main takeaway here is, again, what you had talked about, that you're 45% more likely to develop severe COVID if you have type A. If you have type O, you're 35% less likely to develop complications. And by complications, in the study, they found out you're less likely to need oxygen or be placed on the ventilator. Again, the A and the AB we're not really sure of, but overall, again, this is just showing associations with this, not necessarily that causation you're talking about, Craig.
Dr. John, any idea why type O blood might make someone slightly less susceptible to contracting the virus? Do we know that?
And the reason they think this is happening is because the genes that code for your blood type also code for your immune system, or at least parts of your immune system. And so they think if you're coding for type O, it's giving you a more robust immune system for fighting off coronavirus. And we've seen with blood types that it can affect other types of diseases as well. And so we're finding out more and more about this. At the same time, we're finding out more and more about coronavirus. So getting those two together, looking forward, this is certainly going to give researchers a lot to look at, and hopefully something to find out a little more information, both about the virus and about how we respond to it.
Here's the thing, though. I mean, there's this Quest Diagnostics survey, I think it was last year, and it revealed that fewer than half of Americans actually know their blood type. How do we go about finding out what type of blood we have?
So, Craig, there's a few ways you can do it. You can call your doctor. They might know your blood type because of blood tests they've done in the past. There are online kits you can get that can do it as well. But one of the best ways you can do it, simply donate blood. Before you donate, ask them if you can find out your blood type, because often they give that to you, and you save lives in the process. Or you can do like I did when you're 18, you join the military, and they tell you right away.
I guess that's one way. So again here, just to be clear, just because someone who's watching or listening might have type O blood doesn't mean that they can walk around, not wear the mask, not socially distance, correct?
Absolutely, Craig. That's the bottom line. This should not change your behaviors. As doctors, it's not changing any way we treat patients. The bottom line here is, again, these are showing associations, but it's not something you can let rest your laurels on. You still need to wear your mask. You still need to social distance, regardless of your blood type, because there are people with type O's that are getting sick and dying from coronavirus, and there are people with type A's that are not getting sick and not dying from coronavirus. And so, at this point, it's just statistically more of a research thing than something we can do anything about as the people out in the regular population.
Well, I have you really quickly here. Last question. We had a report on a few minutes ago. Apparently, it's taking in some places 10 days to get your results back from a COVID-19 test. Is that because these labs are just that backed up, or is there more to it than that?
It's because the labs are backed up. You're going to get a bottleneck somewhere. It's easy to take the sample, but once the samples all get sent in, then there's only a certain amount of lab test machines. There's only a certain amount of lab personnel and equipment, and so that's the bottleneck there, plus getting the communication back and forth. Once this bottleneck clears up, hopefully we'll get the test a lot faster.
All right, Dr. John Torres, always good to have you, sir. Thank you, thank you.
You bet.
All right, let's swing it over to Al for another check of the weather. Hey, Mr. Roker.